Ms. Richards, welcome to New Amsterdam.
Thrilled to be here.
So I understand that you were previously at Mount Zion under Dr. Castro.
Yes, I'm embarrassed to ask you, but would you mind? Could you just write warm regards, Molly?
Of course.
It's an old coworker. We recently lost a mutual friend. I can't grip the...
It's not a problem.
Thank you, dear.
I'm Dr. Sharpe. I run the oncology. Dr. Castro and I head the department.
I'm glad to see women are running things here, too. I was a partner at Goldman and Fitch.
Investment banking. Impressive. I have a number of patients in that field, almost all are men.
We gals, as they called us, were about 1 in 10. It was great fun before I was sidelined by this stupid disease.
I can see you're in a lot of pain.
Dr. Castro warned me this latest experimental agent might be rough.
How many have you tried?
I don't know, 7?
Valentina, I've just met Molly Richards.
Dry as a martini, isn't she?
She's suffering.
She's been through a lot, but she's a trooper.
She mentioned how she's on her 7th drug regimen.
She's gone through all kinds of medications that haven't even hit the market yet, even phase 1 trials.
So the drugs you're giving her are only to see if people can tolerate them?
That sounds like a judgment.
If she's suffering this badly and you don't even know if they work.
Molly's been breaking barriers her entire life, so even now with incurable cancer, she gains satisfaction from pioneering new treatments, gives her meaning to her struggle.
And it advances your career.
Excuse me?
Are these treatments helping her or you?
Helen, she's my patient.
Dr. Sharpe.
Bearing gifts.
If you're really the head of the department, surely you have people to do that for you.
Co-head. And I like seeing patients. Make sure they're being taken care of properly.
Control freak, huh? Me too.
Molly, do you mind if I call you Molly?
No.
How did you lose your friend from the letter?
Stupid accident. I confess, part of me envies her. Life, fine. Death, at this point, fine too. It's the middle ground, waiting for death, that's humiliating.
So why are you continuing with the treatments?
Dr. Castro said my tumor is a good one for study. Some genetic variant makes it deliciously interesting.
So you like being part of the process? You find it satisfying?
I used to.
Molly, has Dr. Castro ever talked to you about hospice?
Hospice. The trial. Someone else is still pulling the strings. I miss being in control, especially now, at the end. You wanted to see me?
Thank you, Jules. Molly, are you depressed?
Depressed? No. I'm a lot of things, but that's not one of them.
Do you still find meaning in your life?
No.
And how would you describe the quality of your life?
lacking quality. Why are you asking me this?
These are extremely powerful painkillers. They're very good at what they do. But if you take too many of them, your breathing will slow and you will die. I'm gonna leave the room now. If they're gone when I return, there'll be no questions asked. This is your choice. No one else's. You're in control.
I want to know exactly what you said to Molly Richards.
Why? Has something happened?
She checked out of the hospital after 16 months of working tirelessly on her behalf.
Where did she go?
What did you say to my patient?
Okay, first of all, Valentina. She's not your patient. She is our patient. There are no sides in this department. But yes, I did speak with her.
Of course you did.
And I told her that I thought you were doing an extraordinary job. But if her pain had become too great, I knew that you would understand if she chose not to continue treatment. Because as a physician, there is no way that you would put a drug trial or scientific discovery ahead of the needs of your patient. And I am certain that she appreciated that.
Next time one of our patients has an issue, I promise I'll be equally supportive of you.